Welcome. My name is Dr. Joshua Malley. This is episode 2 of our video series. I'm so excited to have you all back again for another great episode. I thought for this second episode, I'd like to discuss an extremely hot topic, the recently FDA-approved medical device called Susvimo, which was previously known as the port delivery system with ranibizumab. Huge development. I think this is going to be a significant medical device for our wet AMD patients. I think it has a great potential to reduce injection burden and still maintain our excellent, robust visual gains that we've seen with anti-VEGF. So certainly, I think this is a huge step and a huge victory for physicians and patients alike to have a great medical device now that will have sustained drug delivery for wet AMD patients. So for this episode titled Dr. Malley's Top 3 Things to Know About Susvimo. And so I kind of want to talk about Susvimo and talk about the kind of 3 major things that I think are important to keep in mind with this particular medical device. The first thing I want to kind of say is, what is it indicated for? So Susvimo is indicated for the treatment of neovascular wet age-related macular degeneration who have had previously responded to at least 2 intravitreal injections of an anti-vascular endothelial growth factor inhibitor medication. So these can be any 2 injections of either Lucentis or Eylea or Avastin or Beovu or subsequently combination of those. So they have to at least have 2 previous anti-VEGF injections that have responded to them. So those are the key. So that's the key with the indication on the label, and that's like the key thing to keep in mind when we're talking about these kind of patients. Now, in regards to actual efficacy, there's no question that this device works super well. So in the Archway study, 98.4% of patients did not require supplemental treatment during the first 6 months of therapy. So really, that's huge. That's pretty much almost every patient, almost nobody needed a actual supplemental injection, so they're able to go that 6 months until the actual in-office refill. So that thing is just a huge efficacy endpoint, really addresses patient injection burden, and really helps to show the sustained drug delivery mechanism of this treatment for patients. So absolutely a home run hitter on the actual efficacy. The second thing I want you to keep in mind and thing to know about Susvimo is the safety profile. Of course, I think we always have to look at safety whenever we talk about any new treatments, and Susvimo has had an excellent safety profile in the clinical trial. There was one thing to note, that there was a 3-fold increase in endophthalmitis, but that we see was attributable to the actual conjunctival closure and the ability to help to mitigate or minimize conjunctival erosion of the device through the conjunctiva. So I think in the early part of the trial, that was the major issue that they noticed, that if the conjunctiva wasn't closed very meticulously and care wasn't taken to help to make sure that that's well sealed conjunctival closure, that could lead to implant erosion and the subsequent endophthalmitis rates that were seen earlier on in the study. Now, of course, once that was recognized, that was rectified throughout the trial, and those rates were improved dramatically. So I think it's important to keep that in mind and talk to patients about it, but make sure to explain the reasoning behind it and the ability of the investigators to adjust their techniques to help to mitigate that risk. So overall, very safe profile and a very good medical device. The third thing, the final thing I want you to keep in mind about Susvimo, and the thing to remember, is you want to use it for really good ideal patient candidates. And for me, what I've done a lot of thinking about this and who are the best candidates, the way I look at it, a patient that is on frequent injection visits, I'd say every 4 weeks to about 10 weeks, these patients that need that constant therapy, that you've tried to extend out further on injections, but they have recurrences of disease activity and they have to be put on more fixed dosing. I think those are ideal candidates. If they have good conjunctiva, relatively healthy people, and they want to improve their injection burden, certainly I think all these characteristics help to make a very good ideal patient. And I really recommend focusing on those patients that are at that 4 to 10 week injection interval, because I think those are the patients that are really burdened by their injection visits. It's a great option for patients that are on that kind of frequent dosing regimen to possibly achieve very infrequent dosing of potentially 6-month refills. throughout the years of having the device. So really, I think the sustained drug delivery is a huge advancement in our field, and a very, very exciting time to be in retina. We're able to provide patients with this potential option of the surgical treatment for this condition with 6-month refills going forward, to really help them to minimize injection burden and maintain robust visual gains. I hope you enjoyed the discussion, and stay tuned for next episode. Thank you very much.